Health and Fitness with David Hollywood.
With DS Sports. Is your sports club ready for a Christmas kit upgrade? Contact DS Sports. dssports.ie.
Hello and welcome to the first Health and Fitness of 2025. Happy New Year. This week we're talking about farmers' health. Laura Tully from the Fit Farmers programme joins us to talk about its runaway success over the last 5 years. We welcome Dan Quirk onto the show. Dan's son Dylan collapsed and died during a hurling match at Semple Stadium in August 2022. The Dylan Quirk Foundation has already brought cardiac screening to over 10,000 young people in 2024. And you'll meet Dr. Madeleine Nidolig, a GP from Roscommon. She's on hand to give us the on-the-ground reality of what it's like to be a doctor during a health crisis. We are into a new year and many people across the Midlands will be considering picking up a new healthy hobby, as it were. Maybe one for those who are working on the farm might want to tune in and keep an eye on our chat on health and fitness this evening. I'm very glad to introduce Laura Tully from Moore in Roscommon. She's the founder of the Fit Farmers programme, now going into half a decade of its lifespan, going into its sixth year. We're going to tell you all about what comes up on the programme, where the ideas come from and what the benefits might be. Firstly, let's bring Laura into our chat. Laura, thanks very much for joining us and a Happy New Year to you.
Happy New Year to you and all your listeners.
The Fit Farmers programme, as I just said there, 5 years ago now, and to all intents and purposes, from what we can see, it's been a roaring success.
Yeah, and it's a well-known and trusted brand at this point across Roscommon and some parts of the Midlands. I'm delighted to say I started the programme in my own parish here in Moore in 2019 with the aspiration of maybe helping a couple of local farmers and farm families to maybe look after their health and well-being a little bit better. And on that cold January evening, managed to cajole 19 farmers to come and try the programme for 6 weeks in our local hall. And I'm really pleased to say 5 years on, 300 farmers have now taken part in the programme over the last couple of years. And they've engaged with it maybe for 6 weeks in their local area and continued, a lot of them, to keep up a healthy lifestyle beyond the programme. So it's a great feeling to be heading into year 6 now and ready to help more farmers feel better about their health and their body and minds as we head into this January.
I'm curious, over the 5 years, what have you learned along the way? Because obviously you're imparting plenty of lessons and information and giving people the tools to, as you say, live that healthier and happier life. But by the same token, you have worked directly with a group of people in a certain area. You must have picked up a few bits and pieces along the way yourself.
Yeah, and that's a real reward for me. And it's why I continue to do this work. I learn so much from the participants. I learn about what's realistic, what's practical, how to reach people, how to engage people. I learn from that front line really about what life is like for some people and all of the barriers and challenges that they face, not only relating to their occupation as farmers, but like all of us, like about all the ups and downs and challenges that come along in life, and you know how they can get in the way of you achieving your goals or achieving what you want to do. And I love learning about that, and I love learning about ways that I can help people overcome those challenges. And while I don't have a magic wand, I feel like I'm developing skills all of the time by dealing with people and being out there working with the groups and the reality of what comes along. And we've come through in those 5 years dealing with COVID and the aftermath of it, as well as Brexit and all of the climate change and all of the changes that have happened for farmers in Ireland. But we're still here and still going. And I think that's the greatest thing I've learned, is that it's about sustainability. And I think the key to sustainability is small, simple, practical changes done consistently. And I suppose this is the time of year when we all start thinking about that. So I think that's what I've learned.
Okay, you mentioned the classes in the programme take place over the course of 6 weeks. Talk us through the programme, and if someone has signed up or is going to sign up, what are they signing up to?
Yeah, so it's a very simply a 6-week series of workshops and workouts. So a farmer would sign up, you give me a call to sign up to the program. I would welcome you into the venue, which is usually a community centre in a locality. We would offer you on the first week a one-to-one consultation with me. My background is nursing, so I offer you a health check. So I'm assessing your health status, your health history. It's all done confidentially. I offer you blood pressure checks, waist measurements, your heart rate is assessed, your sleep, your mood, and when we also assess your fitness. So we do a cardiovascular fitness test, which is simply a walking test for 6 minutes, and we do a lower limb strength test, which is basically inviting you to go from sitting in a chair to standing up over the course of a minute. And we take that data, and I have a baseline then, so that at 6 weeks after you complete your education and your physical activity program, that we can compare the results. And the results are usually pretty outstanding and very clear in several of those health markers. But what we do over 6 weeks is we come together as a group. We leave all of our egos at the door. What happens in Fit Farmers stays in Fit Farmers. We work as a team. We sit down and have a workshop for the first hour on various topics to do with your health and well-being. So it might be sleep, it might be your nutrition, your movement, really a lot about your work-life balance and how we can really have the best shot at keeping yourself well. And a lot of what I do focuses on how you can age-proof your body to keep you aging well and farming sustainably. We cover a lot about the issues that affect farmers' health, like your heart health, cholesterol, blood pressure, looking at musculoskeletal issues, so things like aches and pains and joint mobility issues. So we tailor it to the group's needs. And the second hour then of the programme is the actual workout. And we do a programme called Fit Sticks for Farmers, which incorporates a full body workout in the hour. We use activator poles, so we're working on strength, balance, flexibility, fitness and fun for that hour. And you get healthy homework going home, so you're expected to do your bit of walking during the week. We aim to get from the farm to 5k, and we often meet up on a Sunday for a walk and talk if that suits people. And we do that for each week for 6 weeks, and by the time I finish up the programme in 6 weeks, people are ready to take it on their own and to keep sustaining it as the year goes on.
Yeah, that's what it's about really, is beyond the classes, obviously being able to carry on that work through the rest of the year, because what you've set them up with is doable, attainable and achievable and as you said, sustainable. There was a study done a few years ago which outlined the fact that the majority of male farmers, 85%, are either overweight or obese. It's higher than the national average of 68% of Irish men. Now, that's according to a study from 2020, so the picture may have changed slightly, but let's just take that as a perspective. It does mean that through your work with the Fit Farmers programme, the ceiling is right up there in terms of the amount of improved health programmes like this can deliver, because the ground is ripe for these improvements to be made. It must give you a decent sense of well-being to know that you're tackling something here that has real scope for, as I said, improvement.
Yeah, and my nursing background would be what lent itself to me developing the programme, because those types of statistics that you've just mentioned, we don't often think of a farmer as being in that at-risk group. We've always imagined farmers to be active, fit and healthy and always on the go. But modern technology and the way we farm, and then the culture of our food and the types of food we're eating over a number of years, and lifestyle changes mean that actually when we look at farmers' health as a profile group, they've got poor health, and they've got a lot of those issues you mentioned in terms of obesity and cardiovascular disease. Farmers don't eat a lot of good nutritious food in terms of fruit and vegetable, high fibre. There are higher groups for smoking and alcohol, and then the stress levels, particularly if you think about, how unpredictable their job and everything around them can be. So the program is tailored to target all of those areas. And certainly then bringing in my day job, my professional job as a nurse and as a health promoter and a health educator, I wanted to help farmers avoid or reduce the risk. So avoid developing issues like diabetes, cancers, high blood pressure, high cholesterol, all of those associated health problems. And if they couldn't be avoided, I wanted to help farmers who already had developed those issues to self-care better. So what I found is that people are ripe for having the right information at the right time, in the right place. And that's what Fit Farmers does. And when you have the correct, trusted, reliable health information, and you have guidance and mentorship and support on how you can tackle and manage your health, you can achieve great results. And that's what I set out to do, and that's what I'm achieving with the groups that I work with. None of it is rocket science. It's what is evidence-based guidelines. They're national guidelines. I'm just, I suppose, breaking down the science into practical, simple, easy to understand language and steps that people can follow. And it seems to be a welcome way to receive that information.
When we come back, Laura talks us through the dynamic of cajoling farmers into taking action on their fitness.
Health and fitness.
With DS Sports. Is your sports club ready for a Christmas kit upgrade? Contact DS Sports at 085 871 5311 or info@dssports.ie. DS Sports, the teamwear specialists. Your success, our priority. Let's grow together.
Midlands 103.
Welcome back. When we left, Fit Farmers founder Roscommon's Laura Tully was telling us about how she presents the information and knowledge to those who take her classes, basically breaking down the science into practical and easy to understand language. What about farmers' attitude and approach to the classes? I put it to Laura that farmers trust farmers, and once they see their colleagues buying into the course, they do too.
Yeah, and we all probably do. There's that huge peer element, and that's one of the reasons why I think Fit Farmers is successful is because they're amongst their peers and people who understand the information from the same point of view, and that's really important. And then I come from a rural background, and I think also, once I disclose my professional background as a nurse, that also gives me an inning with the participants, because traditionally a healthcare professional is a trusted, reliable source of health information. But our relationship in a community centre is very different to the relationship we would have across the desk in a clinic. I'm not lecturing people. I'm not telling them what to do. This is very much providing signposting, breaking down why we would look at certain goal setting and certain habit formation. I'm explaining the psychology around it. I'm educating the participants about why simple swaps and practical steps could make an impactful difference. And I think that's the camaraderie and the team approach to this is a success in itself. And what comes out of that organically then is a lot of social connections and a network. Often farmers are meeting up with guys they might have gone to school with, they might have played football with, they just mightn't have had the chance to reconnect in later life. And there's a bit of banter and there's a bit of crack, and we don't take it too seriously. And all of that combined just gives this the recipe for success. So people are, of course, reticent in signing up. They often say to me, I don't know, would I be able for it? I don't know if this will suit me. I don't know if I, want to do it. Some are cajoled into doing it. Some are nagged into doing it. Sometimes their partner rings up and books them in. But I've yet to meet any of the 300 farmers I've worked with who say they regret doing it. So you mightn't get, you mightn't be running a marathon at the end of 6 weeks. You mightn't have, changed your trouser size, but what you will maybe have gotten instead of that is a boost to your mental health, better sleep, better eating habits. One man said to me there before Christmas, he could bend down and tie his shoelaces easier. There's something to be gained from any little change you adapt, and any habit you can focus on for that 6 weeks, and something that you want to take beyond that. So making it enjoyable and sustainable helps those people leave the reticence behind, and at the end of 6 weeks there's a great sense of achievement and accomplishment, and the feedback is very, very positive, and at this point 100% of the participants would recommend the programme to others, so that speaks for itself.
Yeah, it does. And I know you're so often fully subscribed when it comes to these things. Just firstly to point out, like, the farmer who talked about being able to tie his shoelaces sounds like a small thing, but those small things are such big things when it's a crucial part of your daily life, as it were. If anyone listening is thinking, yes, I'm going to take this step and actually do something like this, Fit Farmers programme does have some space at the moment for classes coming up, does it?
Yeah, the next programme is actually running at St. John's Community Centre in Lacaro in South Roscommon. It's just off the main road there behind Coffee's Pub, so it's a handy to reach location, and that's starting on January the 9th next week at 7 p.m, and I have a couple of spaces left on that programme. If anybody's interested and wants to give me a call, I'm happy to share my number. A lot of people have it at this stage, so it's 086 34 74 662, and that'll be the easiest way to reach me, and just give me a call anytime about that programme or maybe future programmes.
Laura, the best of luck with everything going forward in 2025.
Thanks for the chat about it, and Happy New Year to everyone.
Next on Health and Fitness, we meet Dan Quirk. He's the father behind the Dylan Quirk Foundation.
Health and fitness
with DS Sports. Is your sports club ready for a Christmas kit upgrade? Contact DS Sports at 085 871 5311 or info@dsports.ie. DS Sports, the teamwear specialists. Your success, our priority. Let's grow together.
Midlands 103.
Dylan Quirk was 24 when he collapsed during a hurling match and died of sudden adult death syndrome, otherwise known as SADS, on the 5th of August 2022 in Semple Stadium in Thurles. He was captaining his club, Clonalty Rossmore, in a championship match at the time. The Dylan Quirk Foundation was subsequently established by Dylan's family, his parents, Dan and Hazel, and his sisters, Shannon and Kelly. In their first full year of operation, after hoping to screen up to 5,000 young people across the country to prevent and to limit the effects of sudden adult death syndrome and to raise awareness about it. Ultimately, that target was met and exceeded, and in fact over 10,000 young people across the country have benefited from cardiac screening this year. I'm very glad to say that Dylan's father, Dan, joins us on Health and Fitness this evening. Dan, as a preface there, it has been a remarkable year. Talk us through it from your perspective.
Yes, indeed. Thank you for calling. We started fundraising, I guess, in December of 22, just 3 months after Dylan had passed. We didn't know where we were going, what we were going to do, because we were, I suppose, like a lot of people, unaware of what SADS is and where it comes from. So we started fundraising in December of 22 with the hope to start screening early 24. So we did. We actually started screening on the 10th of January 2024 with the hope of screening 5,000 young adolescents between 13 and 18. And I suppose the fundraising was so successful, we managed to screen 10,000 in our first year. So it's amazing results. And it's just a testament to the different communities all over the country that helped us fundraise and get this screening done.
Yeah, so there's a couple of things there to look at. Obviously, I think it's worth touching on how, considering the amount of people who've engaged with the foundation and the screenings, it shows that there was a huge groundswell of support for what the foundation was doing, and a lot of people were probably touched by Dylan's passing, and that's come out in such a positive way over the last 12 months.
Yeah, absolutely. Yeah, it's amazing the support and that we've received as a family and the foundation since we started. We probably started as a GA foundation because that was Dylan's major sport, I guess. But soon after, we realised that, look, this is a problem in every sport, particularly in this country. So rugby became involved, soccer became involved, basketball, tennis, golf, you name it. So I think we have 35 sporting organisations involved with us at the minute. So it's great to see that, and it's great to see that it's just not the one sport, and that people have embraced what we're doing all over the country. And to say that we have screened into 26 counties since we started is great. So it just goes to show it's not just a local charity. It's national, and probably will be international as time goes on.
There's a national need as well, because on average about 100 young people in the country die each year from SADS, and that rate is a lot higher than what's reported in other EU countries. So the positive impact that this can have, considering the numbers that you managed to screen last year and presumably over the course of this coming year, there's a real imperative to improve people's health and welfare through this programme.
There is indeed, and the great thing about screening is that there can be many different issues that kids can have, but when you screen, you raise awareness not just with one kid but the kid's family. So like really realistic, when you screen 10,000 young kids, the outlay, the amount of people you're hitting is probably somewhere up to 100,000. But like from what we've seen, we deal a lot with the first responders all over the country who've been tremendous, because they're on the ground and they see it all the time, because they're first, as it is what it says, they're first to respond if there's any issues. They seem to tell us that in the last number of years this is getting worse, so it's something that needs to be looked at in a big way. And I suppose we started the ball rolling with a bit of screening, and there'll probably be more initiatives as time goes on. But look, as I said, without the support that we've got from all over the country, we wouldn't be where we are today. And we have huge ambitions for 2025. We have a great board behind us, and we've got great support in various different sports. So that'll take us to where we need to get. I guess realistically, we want it to be mandatory that any young 12 upwards is playing sport, make it mandatory they're heart screened. And it's just a huge relief to the families of these people that if that's done, they know their kids are safe playing sport. We all want our kids to play sport. It's mentally and physically, it's so good for them. But look, if a problem is heart, he can't play sport at any level really, and the problem is parents are not aware of this, because I guess kids are checked when they're born. A baby is checked, his heart is checked, and realistically it's never done again unless there's a problem. So that's what we try to change the mindset of people, I think, and it's been very successful so far.
Yeah, and as you say, beyond the obvious benefit of understanding your own personal heart health situation, there is this other side to it where people are engaging with the health service and they're informing themselves about their health, and they're actually creating a pathway between themselves and those who can ensure that they're healthy as they grow up. And when you're younger, obviously, these aspects are more important as you're developing. Let's talk about 2025 then. You more than doubled your target of screening people in 2024. As you say, you will consistently be calling for mandatory health screenings when it comes to this stuff. What else would you like to see happen for the Dylan Quirke Foundation over the course of 2025?
Well, I suppose to broaden the base, like we're starting to get help from the UK, from the States and Australia. And I think there's huge outcrying, I suppose, of support from Irish Americans, from Irish Australians, and all these people. These people that do have funds to invest with different foundations and charities. But by dealing with these people, you're getting to know the right people. We're meeting top cardiologists all over the world, which is, again, I suppose it's more information. And the problem with all of these things I find is that while awareness might be there to a certain extent, knowledge is everything, and we just need to know more about what's going on. And unfortunately, generally, governments are not doing this now. This happened in Italy 20 years ago where they started screening, and they brought the death rate down by 89% in 20 years. So we do know it works. So I think knowledge is, as I said, is king, and we'll be doing our best to make sure, as well as screening young kids, that we get knowledge to schools, to community, to know that this is a serious problem. And I think it's very good for kids, not just for their heart, but for mentally, to know what they're doing, and to get kids into, I suppose, a right system as to where they're looking after their health. And I suppose anything we can do to improve that, we'd be delighted to do that.
Talk us through, if somebody listening, be it a parent or a younger person, is considering just doing this because they think it's the right thing to do or to go about it. Firstly, how do they go about it in relation to the Dylan Quirke Foundation? And talk us through the steps that are involved in a screening.
Right. So generally, what happens is, if you have a GA club or a soccer club or whatever the case may be, would contact the Dylan Quirke Foundation. We work with a company called Advanced Medical Services in Cork who do the screening for us. Generally, if a club does it, what happens then is the club contact us. We contact AMS, Advanced Medical Services. They will send out a questionnaire to the club involved and say, right, we're screening in your area on such and such a day. If you'd like to be screened, come back to us with numbers. Now we can screen 45 kids in any given day. And it's costing us €100 per screening, so it's costing us 4,500. So we would like for people to try and fundraise to support us in what we're doing, because as like we have a waiting list now of screening, so we're doing our best to screen as many as we can. But that's the procedure basically. Once AMS get back to questionnaire, a date is organised. At that point, then the cardiologist goes out, a receptionist and a nurse goes to a location, be it a community centre or a GA club or soccer club. The screening, the whole thing takes about 50 minutes. It's an ECG, a history of the family history. An ECG is done. It's sent back to a team of cardiologists in AMS in Cork. I think they have 8 cardiologists there. And if there are any issues, then the next step is taken from there.
And finally, Dan, talk us through what it means to yourself and your family to have had the success in getting so many people screened over the course of the last 12 months, and to see the Dylan Quirke Foundation sort of soar and succeed as it has done, and the kind of the community buy-in from across the country.
Well, look, for us to lose a child is I guess is probably the most horrendous thing can happen to anybody. And unless someone has lost a child, they won't understand what we feel, what we're going through. But if you can help other people, and if you could help other families, that in the hope that it wouldn't happen to them going forward, that's a great solace to us. And the work we've done, I'm sure they'll be looking down and be very proud of what we're doing, that we're trying to help other families. And like, just a quick note to say that of the 10,000 we screened, 243 have had problems with their heart. That's a big, big number. And I know of that figure, it's in double digits that were serious issues that have been sorted. So I guess we know we're doing the right thing, number one, and we know that their lives are being saved. And if we can continue to grow this, and as I said, eventually, if we can go to government or the sporting bodies to make this mandatory, we know it'll be a huge success. And if you cannot help your neighbour, your friends in life, I don't know what life is about, to be honest.
Dan, you've been great with your time. Much appreciated.
Thank you very much. Thank you. Bye-bye.
A shortage of beds, long waiting lists, problems with recruitment and burnout. This is the story of being a GP in this country through many years of health crises. Next, you'll meet a Midlands GP who's working at the coalface.
Health and fitness
with DS Sports. Is your sports club ready for a Christmas kit upgrade? Contact DS Sports at 085 871 5311 or info@dsports.ie. DS Sports, the teamwear specialists. Your success, our priority. Let's grow together.
Midlands 103.
Emergency departments across the country are starting to fill up at this time of year, I suppose, after festive mixing and all the rest. This is to be expected. But we do have, in the bigger picture, a great issue with our health system, and it has basically been moving from crisis to crisis over the course of at least the last quarter of a century for many of us, as long as we can remember. The Irish Medical Organisation, the IMO, is calling for the government to make health its number one priority to address chronic capacity issues in public health services. Those on waiting lists across the Midlands and beyond will know all about it. To help me tackle this issue on health and fitness this evening, Dr. Madeleine Ní Dálaigh from the IMO joins us. Madeleine is a member of the GP committee on the IMO and is from Castlerea in Roscommon. Madeleine, thanks very much for taking our call.
Not at all, no problem at all.
Talk us through the IMO's perspective and what is driving this specific call to the next government, whenever they're formed, to make health a priority.
Look, I think it's clear to anyone at the moment in Ireland that we can see that our health service is extremely vulnerable, particularly at this time of year. And every year we predict that there's going to be problems with trolleys and with overcrowding in hospitals. And what that does is it shines a light and lays bare to the fact that our system is highly vulnerable to any sort of increase or surge in demand. And so what we need is a really, we've been calling for this for years, a proactive approach to increasing capacity. So we need 5,000 hospital beds, and sometimes talking about hospital beds can be confusing for the general public. It can seem, well, why can't that happen very quickly? Well, we need the government to look at the fact that each of those beds will need nursing, healthcare assistance, facilities, investigations, laboratory support, and so it is a big body of work, but it can be done. We know from COVID that when there's a will, there's a way, and things can improve quickly, but we really do. I think the word crisis, because we use it almost every year, and now we use it right through the year, it's becoming, I suppose, a word that's losing some of its meaning. But when you're at the coalface in general practice and you're seeing patients that really should be in hospital, but they beg you not to send them into hospital, it is a crisis for us every winter. And we're seeing it right now at the moment. People who need to be in hospital end up in trolleys. There's no way a doctor or a nurse, healthcare professional can deliver proper care when a person is on a corridor in a trolley, and certainly dignity is not something that patients lose their dignity with regard to having no access to toileting and very basic things that they need. So we do really need to take this seriously, and as I said, 5,000 hospital beds are needed. We estimate that 20% of consultant posts are unfilled throughout the country, and a third of psychiatry posts are unfilled. And we know that 83% of our non-consultant hospital doctors are working more than 48 hours a week, and they're becoming exhausted and frankly burnt out.
Okay, there's a huge number of issues and important issues that you've highlighted there, from infrastructure to staffing and how the two are interlinked. Let's dwell on the moment for the call for 5,000 extra beds. The Department of Health in the previous government was very keen to emphasise that they had, in the lifespan of the previous government, added capacity to the healthcare system in this respect. How do you judge the performance of the outgoing Minister, Stephen Donnelly, the Department of Health over those 4 or 5 years, and how far is the gap that needs to be bridged?
Look, Stephen Donnelly had certainly did a lot for women's healthcare, and we saw an expansion of GP medical card services as well under his watch. While there have been some increase in hospital beds, we're playing catch up. We do know that in the last decade we've had a huge increase in our population. So we're now at 5.3 million, partly because we've now become a healthier aging population, but with age comes complex comorbidities and complex medical care. We also have an increase in population because we have become a wealthy country, and so we're attracting people to come here to work. So we need to provide, and we need these people to work in our countries, but we need to also provide medical services for the whole population, both our new Irish and our incumbent Irish. So I think that playing catch up has been something we've done for years. And it isn't an easy job. Not for 1 minute saying that this is simple for our minister or future minister or for the HSC, but we really do need capacity in the hospitals. Calling it an accident, an emergency or casualty crisis is really misleading. It's that the casualty is a bottleneck, and so there's nowhere to send the patients. And then, of course, it's the step down facilities need to be developed, because patients have nowhere to go if they need intermediate care before they're actually discharged home. So I think that the capacity cannot be addressed until the beds are provided and the services around those beds are provided. Okay.
One of the characteristics of, I suppose, the winter spike in the crowdings in A&E and so on is that elective surgeries in the new year tend to get cancelled. And obviously this just exacerbates another problem within the system, which is the huge waiting lists for patients when it comes to elective surgeries. What's the current situation on the ground as far as the IMO understands it in terms of elective surgeries in 2025 in the next month or two?
So elective surgeries are being cancelled because as we have more and more sick individuals going into hospital, a certain percentage of those will need high dependency care and intensive care admission also. And so with any surgical list, which would be an elective surgery list, such as for hips or for any of the ENTs, so tonsils, etc., they are pushed down the list because they're not deemed as urgent. However, if you're that person with chronic hip pain, or you're that youngster who's getting really nasty recurrent tonsillitis, then that's very important to you. And it's very sad for them when they are, all geared up to get an operation and then they're told, no, I'm sorry, you can't have it. And, many of our surgeons are getting very little theatre time during the year, not to mention this time of the year where their lists are cancelled. And so theatre time is really important to get our surgeons doing what they do best and what they're trained for. So it is very difficult out in general practice because we're also then treating patients who are chronically unwell, who we know there's an answer to their issue, be it a replaced hip or be it a tonsillectomy, but we're managing that on top of what our other patients. And so at this time of the year, then that becomes doubly pressurized in general practice at the coalface. And then we know our patients personally, and so we're invested in the community. We live among our patients. On a professional level, it's difficult, but also on a human level, it's quite difficult to see that patients are being pushed down the list.
Yeah, I can only imagine what it's like to be on that side of the desk, being either the bearer of bad news or just having to help someone understand what the realistic situation is.
Yes.
And then, if we just drill down into that dynamic for a second, Madeleine, if you look at someone in chronic pain who maybe needs a hip replacement, the longer they go without that, related illnesses or damage will then happen, be it compensatory stuff like in their knee or their back, and they will be having to interact and rely on the health service for many months longer than they might have to have done otherwise. Add to that, I suppose, the mental health damage that people go through if their chronic injury or illness or disease isn't being treated in the speed it needs to. That can be exclusionary in our lives, which can have knock-on effects on mental health. And obviously, the resourcing of our mental health services is another aspect that the IMO is underlining here. So much of this stuff is interlinked, isn't it?
It's all interlinked. If you look at an older person who might have chronic hip pain, he or she may be unable to participate in their game of golf or in their walking club or indeed be comfortable enough to sit for a game of cards with a friend. Something like that has a huge effect on a person's mental health and well-being. Then if you bring it back down to a young sports person, he or she can't participate at work properly or fully because they need their cartilage or their repaired, or they need their cruciate ligaments repaired. They don't have health insurance. So it has a knock-on effect on the workplace. It has a knock-on effect on mental health. And then, of course, children who have, recurrent, as I said before, I'm using tonsillitis as an example, but that they're missing out on school. So, I suppose that's to do with the elective surgeries that I'm talking about, but it's to do, the capacity is the common denominator for all of this. And with regard to the mental health services, it is something the IMO has highlighted. We estimate that there's a third of consultant psychiatry jobs not fulfilled. And part of that is we need to make the consultant posts attractive. There's no point in having a consultant psychiatrist in an area if he or she does not have support services such as community mental health nurses, beds, acute beds. I know in our area in Roscommon, we have our mental health or acute psychiatry unit is constantly at capacity. There's been a call for increased community support, so patients who don't need acute, who could do without acute admission and could be supported at home if we'd enough staff, that those services be developed. So it is about capacity for the services, and it is a big ask for whoever the next minister is, but we really do need to look at this in a practical manner. the closure of beds some years ago we're still feeling the effects of that, and now our population is much bigger. So I feel like I'm going to be here next year again talking to you or one of your colleagues about this again, and it's just such a shame for patients on the ground.
I want to finish up on your own personal experience, Madeleine, and I'd actually draw similarities to speaking to Gardaí over the last number of years. There's a sense that they're trying to push water up a hill in a way, and that can affect the morale of the sector ultimately, and you've alluded to that. But day in, day out, if doctors don't see any evidence or promise of a reprieve in the future, it's hard to imagine everyone staying in their line of work or certainly being able to be happy in their line of work.
Yeah, it is. I see it among my GP colleagues who, certainly by the time the end of the winter surge comes, there's a huge amount of fatigue, and we find it quite difficult to get locums into our sector. So it can be difficult for GPs to take annual and sick leave, and maternity leave actually as well. Which, particularly if you're in a smaller practice where there isn't cross cover, some of the bigger practices can cross cover, so it can be a little bit less stressful. But yes, there is. We have to support our young GPs coming into the sector. We have to make it easier for them to become partners. The GP contractor model has always been a successful model, but it does need supports because times have changed. And I think that burnout, when it happens, is very sad because we've all trained for such a long time, and that if the supports are within the system, then it means that we will bring more to the system, and we will avoid burnout if we can get our time off.
Yeah, there's a huge job of work by the sounds of it, Madeleine, and we wish you the best over the course of this forthcoming year, and in terms of what the IMO is calling for as well. Just before I let you go, we are maybe approaching the peak of flu season in the country. No harm for us to maybe ask you to impart those few sound bites of wisdom when it comes to managing our health, or if indeed we do start to feel symptoms. You can give us the greatest hits on that kind of stuff now if you want.
Well, the greatest hits, I think definitely we know vaccinations work. So your GP will have vaccinations for flu vaccine and COVID boosters. They're the two main ones. And also for our youngsters, not to forget the children. We've got a vaccine now that is a nasal drop form. It's very, very easily administered and not a bit painful, and it's free for our children. And our pharmacists also have access to those vaccines. So please get vaccinated. Please avoid very crowded areas if you don't need to be there. If you're unwell, take the logical approach and stay at home and avoid spreading the virus. Wash your hands and don't visit vulnerable people even if you have a sniffle, because a sniffle to a healthy young person could be something a lot more serious for a vulnerable, immunosuppressed or older person.
Dr. Madeleine Ní Dálaigh, member of the GP committee on the IMO from Castlereagh, Roscommon. You've been great with your time. Thanks for joining us on Health and Fitness this evening.
No problem. Thank you.
We're done for Health and Fitness this week. I'll be back with you for Saturday View tomorrow morning. Joe Cooney is waiting in the wings to bring you Country Roads. Take care of yourself, and I'll talk to you soon.